my name is Liz and I'm a trainer with Welsh Hearts. We're going to do a quick demonstration of if you come across somebody who's had a cardiac arrest in this COVID times, how to deal with the person. So the first thing you do is you look around, you check for danger, you make sure it's safe to help the person. We then go down, we talk to them. Hello, can I help you? Are you okay? The difference being at the moment is we don't go down to the person, we don't put our face anywhere near them at the minute. So we could still open up their airway, look down the chest, look for the rise and fall of the chest as it's going. This person's not breathing, so we're going to loosely place material over the mouth and the nose, but not restricting their airways at all. That's just that with COVID, the virus is transmitted through water droplets, so we're protecting ourselves. If you've got your own mask, place that on at the moment. We then go completely centre of the chest. We're going to go a depth of 5 to 6 centimetres to the rhythm of Staying Alive by the Bee Gees. Okay, so I'm going to start now. In normal times we would do 30 compressions with 2 breaths. However, unfortunately it's not ordinary times, so we're not going to do any breaths at all, especially if you don't know the person. We've sent somebody off to get a defibrillator. They've come, so the defibrillator is here. You carry on doing continuous compressions, especially if there's somebody else, they can help you, swapping every 2 minutes. With your defibrillator, you'll have a rescue pack. In your rescue pack, we've now got a pair of gloves, which is best to put on, a pair of scissors, which you can cut the clothes, a piece of material that you can just wipe the chest off, and there's also a razor if the person is very hairy, but we're just going to shave where the pads go. The pads will always go right shoulder, left side. Think of a driver's seat belt. Time is of the essence. As soon as you can get the defib on, the better. So switch on. In the meantime, someone is still doing
now
compressions.
Adult mode. Follow the voice prompt calmly. Remove all clothing from chest and stomach.
Okay, we've done that.
Rip
Prepare
clothing
the chest.
if necessary. Take out the pads from the bottom
the pads
of the
are
device.
underneath. You take them all the way out and open them.
Tear open the pad packaging.
Okay, the pads are labelled 1 and 2 with a picture of where they go. Think of that driver's seat belt.
On each pad.
Pad number 1
peel off the pad labelled 1
goes on the right
and
shoulder
stick to the bare
and a
skin
slight
of the
angle.
patient, exactly as shown in the picture.
Pad number 2 goes under the chest, under the arm, as a diagonal
to the bare skin
across
of the
the
patient.
chest.
Do not touch.
Really important now, we don't touch.
Analyzing
If we're
heart
touching,
rhythm.
it's going to pick up what our heart rhythm is doing, not what the patient's
Shock
heart's doing.
advised.
It's going to shock, which is
And
good.
clear.
This is the
Flashing
only time
orange
you've ever
button
heard any of
now.
these, so you check
Deliver
top,
shock
middle,
now.
bottom. I'm clear. Shocking now.
Press shock delivered.
Okay, look for the chest, see if it started to
CPR
rise and fall.
now.
If it
Press
hasn't,
the
we're going to
blue
carry on with our
button.
compressions.
CPR.
Pressing the blue button,
First.
hands interlocked, centre of the chest, and go with the beep. So every beep is a compression. And you just keep going like this for 2 minutes until the machine will tell you it's reanalyzing. So after 2 minutes,
Breathe.
the machine will reanalyze. We're not doing the breaths.
Do not touch the patient.
Really important again, we don't
Analysing
touch.
heart rhythm. Shock advised.
Again, check top,
And
middle,
clear.
bottom.
Press the flashing
I'm clear,
orange
check
button
nobody is
now.
touching.
Deliver
Shocking now.
Shock delivered.
Okay, check the breath, see if
Begin
it started to breathe.
CPR
If
now.
not, straight back
Press
onto the
flashing
chest.
blue eye first.
And again, you carry on again for another 2 minutes. It won't always shock. It depends what rhythm the heart is in. It depends how long the person has been in cardiac arrest. So sometimes the machine
Do not touch the
We'll
patient,
tell you, do not
analysing
touch.
heart rhythm. No shock
Okay, so this
advised.
time it's not going to shock. However, you
Begin
carry on doing
CPR
compressions.
now. Press the
Blue button, back
Third.
onto the chest, again for another 2 minutes. Okay, somebody will have called 999 and hopefully it shouldn't be long. So just keep going with normal compressions, no rescue breaths. If you can, keep a loose piece of material over the person's mouth.